and record on this computer. And we are now recording, and now I'm going to go and shift us over to Facebook Live. So that'll just be one moment. All right. All right, and this will be public. Okay. All right. I'm going to share to Black Indians and go live. It takes like a few seconds for it to go live, so I'll let you know as soon as I see it. Prepare us for that.
Okay.
Right now, it's just saying no. It says meeting place. All right. Okay, great. I think we are now live. Awesome. Wonderful. And I will share now. So we are shared. Wonderful, wonderful. Okay, great. So now here we go. And I'll double check one more place just to make sure we are live, because I know a lot of people were waiting and messaging me today about, are you live yet? And hello to everyone. If you can see me now, let's see if you can see me. Let me take a look. Oh, you can. Hello, everyone out there in Facebook land. Thank you for joining us tonight. I'm very excited for our special guest joining us. So please share in your pages, everyone, in your groups. Please be sure to share that we are now live. We are excited to be here, and we're going to get started in just a moment. I don't see many of you commenting. Please post your comments and questions below. Thank you so much. We are very happy for you to be here. All right. Okay. And there we go. We are live. Wonderful. All right, we are going to get started, everyone. Thank you, everyone, for joining. Hi there. Hey, Melanie. Thanks for saying hello to me already. Hello, everyone. My name is Kimberly Knight, founder of Black Indians NC. And thank you, everyone, for joining us tonight. I'm here with a very special guest joining us, Dr. Ronny A. Bell. He is here joining us tonight for our Conversation Circle episode 11. Wow, exciting, everyone. We're on 11 episodes since last June when the pandemic started. And I just want to acknowledge and thank everyone that tunes in to all of our events and things like that virtually. We've had some really awesome talks, so I'm really excited for each of you to be here tonight. And so first off, I want to definitely acknowledge the land that I'm on right now. I'm in the mountains area, so here in North Carolina. And I want to acknowledge the Eastern Band Cherokee for this land that I'm here present on, and many are my ancestors. So I would like to acknowledge the Eastern Band Cherokee tonight and thank them for all their contributions of what they try to do for the tribe and for the community and everything else. So I want to definitely give honor and presence for that tonight. So thank you. And hello to any of my Eastern Band Cherokee friends out there watching tonight. Thank you for your messages. I get them and I love them. So thank you so much. So tonight joining me is Dr. Ronny A. Bell. Yay, see him here. And Dr. Bell is the director of the Office of Cancer Health Equity for Wake Forest Baptist. And so I'm really excited for him to be here because he's also the Associate Director of Community Outreach and Engagement and a chair of the North Carolina American Indian Health Board. And he's also a professor for Wake Forest School of Medicine and also a citizen of the Lumbee tribe. So for all the Lumbee people watching, hello to you out there. We have a shining star here from the Lumbee tribe that is joining us tonight, Dr. Bell. So I would also acknowledge on our Black Indians NC Powwow Council, Dr. Allison Matthews over there at Wake Forest as well, for introducing me to Dr. Bell. I want to thank you, Dr. Matthews, for your support. Thank you so much. So as we begin tonight, everyone, if you have questions or comments, you know the drill. If you're new to us, may not, please post them in the comments and everything below. We will see if time permits for us to be able to answer some of them, but please post them below. Thank you so much. All right, thank you for being here, Dr. Bell. Thank you so much. How are you doing this evening? Are you able to hear me? Hi. Oh, can you hear me now? How's your sound? Can you hear me, Dr. Bell? Oh, can you hear me? Okay, now I can't hear you. Oh, let's hold 1 second. We had it all clear, guys. We might have a little technical difficulty just for a moment. Can you hear me now? Oh, I can't hear you. No, can't hear you. No. Mm-mm. No, not now. We were doing really good, everyone. We could hear him earlier, but just one moment. Just hold on with us. Are you able to hear me now? No, not yet. Thank you, people, for watching. Can everyone hear me out there on Facebook land? Please comment below if you can. If you can hear me, please comment below. Oh, no, I can't hear you, Dr. Bell. No. Okay, great. Melanie can hear me. Okay, let's see. Facebook Live can hear me. Okay. And adjust your headphones there. Not yet. Hello, everyone. Thank you for in the comments. Hey, hello there, everyone. Yes, you can hear me. Wonderful, wonderful. Please comment below. Just checking our sound and tech here with Dr. Bell. We were doing so good. We had it. We had it together, guys. We had it. Oh, can you hear me, Dr. Bell? Okay, you can. Okay, good. I just can't hear you. Okay. Okay, thank you, Lou Gent, for saying couldn't hear Dr. Bell. Yes, we're working with his technology over there. We want to make sure that he is good to go. And in the meantime, everyone, please share. Please share this in your groups that you're in, that we are now live. And we are working on it now. And if you have comments or questions concerning COVID-19, please post in the comments section, please. Thank you. Thank you. Thank you so much. Give you guys some hearts there. Thank y'all so much for your patience. All right, Dr. Bell. Hopefully we can get you going. We have some good things to talk about tonight. Can you hear me now? All right. I hope we still have Dr. Bell there. Hold with us, everyone. Oh, can you hear me? Okay. All right. We can't hear you. Thank you, everyone, for joining tonight. Please post comments and questions below. We're talking about COVID-19 tonight. As soon as we get Dr. Bell up and going. We had him good, everybody. We had it all together. But sometimes technology is just a little tricky sometimes. But I hope everyone is doing well. If everyone's doing well. Oh, good, Lou. Thanks for letting me know you can hear me. All right. We have a Nikki by Mustafa. Hey, Ronnie. Yes. Thank you for joining us tonight. right. Hey there, everyone in the comment section. Hold on. Don't worry. We're going to get it together. Thank you, Lou, for that. It is okay. This does happen. Technology does sometimes glitch a little sometimes. And shout out to all of the ones that have been watching this conversation circle since June 2020. Thank you so much. Will it help if Dr. Bell rejoins? That could be something. We can try that again. Thank you, Melanie. If you want to try to rejoin, you can, Dr. Bell. Okay. Yeah, you can rejoin. You can go out and come back in if you like. Oh, I can't hear you. Mhm. Can you type in the comments? Mhm. Thank you. There we go. Oh, yeah, you can hear me. That's right. Okay. Do you think you'd like to go out and come back in again? Okay, that'll be fine. All right. All right. He'll be right back with us, everyone. Just hold on. Hold tight. Okay, sometimes I've had problems with audio with my students. Thank you, Melanie, for acknowledging that. Thank you. Yes. We'll wait for Dr. Bell to come back in. I'm going to admit him back in. All right. Okay, your audio did not connect. All right. Let's see. Your audio did not connect. Okay, connecting to audio. There you go.
Can you hear me?
Yes.
Yay! Yay! Wow. You think this is the first time I've been on a Zoom meeting, as I do this 7 or 8 times a day.
Right. I know. I've become the type that I've learned Zoom, Be Live, Microsoft Teams,
WebEx.
yep, Cisco WebEx,
Yeah.
all those go-to meeting platforms. So
Yeah.
yes. All right. Everyone in the comments is saying they can hear you. So we are good to go.
Good job. All right.
All right. Thank you everyone for holding on. Okay, well, we're going to get into some questions about COVID-19. I know a lot of people are just got so many questions out here about the vaccine as well as the actual COVID-19 itself, the virus. So we're going to get into some very popular questions I've gotten in the comments from you guys out there about COVID-19. And my first question to you, Dr. Bell, in regards to COVID-19 and Native American communities, have you seen an increase or a decrease in access to COVID-19 testing?
So yes, so with regard to testing, yes, we have seen an increase in access to testing. And you know, I want to make sure people understand just how things have changed so dramatically in the last 14 months. I mean, you know, our first case of COVID in North Carolina was, in March of 2020. So to think about what has changed in our world in that period of time is just astounding. We didn't have a test for COVID. We had no idea what we were looking at. And so the fact that we, not only have 3 different types of tests, but now have 3 different types of vaccines is just, it's an incredible feat. And so, we started out very poorly, not only in North Carolina, but across the country. We started out very poorly in getting testing resources in communities of color. We didn't do a great job of providing safeguards for people in communities of colors. And so if you think about the factors that put and American Indian people have the highest rates of COVID deaths and hospitalizations. And you think about the things that put Native people at risk. So the things like, pre-existing conditions, living conditions, working conditions, all of those things kind of created this perfect storm where, systemic injustices longstanding, persistent systemic injustices manifest themselves now in what we're seeing with COVID-19. And fortunately, we're catching up. So, and particularly, we also have to think about, for Native populations, thinking about, many of them living in rural, remote areas where there's lack of access to healthcare. Um, the fact that we are now able to say that we're doing a better job of testing in those communities is a testament to our local health departments, to our local primary care providers. So yes. Now I'll say all of that with the caveat that there's a lot of data that is not collected on race and ethnicity when it comes to testing. There's a lot of, unfortunately, racial misclassification. So, people are coded as one race and they're not that race. They don't identify as that race. So that's the challenge I think that we're faced with, is that we see these data, which makes sense to us. I mean, we understand that all of the pre-existing conditions, both health conditions and living conditions and work conditions, contribute to this major burden of COVID-19. But, we also have to understand that we may not be seeing the full picture just because of the data that's available to us.
Absolutely, because I think one thing, we're all waiting on data. We're all waiting to see how the results are going to come out in various communities across the state. And I think acknowledgement that there's a lot of people that might be not classified exactly how they identify, whether that be by race or gender.
Right.
And then you have the concerns about the access. I'm from originally Wilson, North Carolina, but most of my family's from Nash and Halifax County, very rural areas in the community, and just having the access to be able to have health care and even access to proper environmental factors all come into these risk factors that come in, whether it's the food, our water, whatever it may be. It's just putting all those factors together, and then access to medical care. Just thinking about at times when some of my elder family members of living somewhere where emergency can't get to them, emergency services as quickly as you can in a more urban area. In rural communities, it's more of a collective of working together. So
Right.
yeah, I'm glad to hear that there is some testing and things going on for that. And so my other part to that question is, how can the public health professionals increase that access to testing in rural communities?
So I would say certainly, the best way to do that is to build trust in the community. So, to the extent that you can, work with community gatekeepers, that if you can, hire members of the community to be your spokespersons, I think that helps a lot. I think helping mitigate that fear sometimes that comes about in a situation like this. I worry about our elders with the social isolation, and so thinking of ways to work with, churches, working with senior centers, working with community-based organizations, with tribal leadership,
Mhm.
just to say, look, can you work with us to try to get the word? And some of the tribes are doing, Eastern Band's doing a great job with that. Lumbee doing a great job with that. It's just our smaller tribes in rural communities just don't have those resources. So it makes it that much more challenging.
Yeah, and I'm glad you acknowledged that because it is a lot challenging. And hello to all my Maharan people out here, Halawasaponi, Kohari, Wakamasuan. I know that it's not as easy to get access to certain healthcare benefits or, things like that into COVID testing when you're living in a more rural, isolated area too. So I think it's good that the public health officials are making this something that's a staple to try to make sure people have access nearby. I've seen a lot of COVID testing events.
Mhm.
I've seen that going on. Particularly, I want to shout out the Mahara Nation. I saw theirs online and I thought that was amazing. But I think it's great that more communities are trying to work together to have testing going on. And also with the vaccines, with the Halawasaponi, seeing them having different clinics. So I'm happy to see people are trying their best in the midst of learning at the same time.
right.
Mhm.
Yeah, and so, you think about, and you think about what has happened with COVID,
Mhm.
similar to the ways you think about, so, diabetes, Native Americans having the highest rates of diabetes and the highest complication rates, heart disease, stroke, cancer, being diagnosed with cancer at later, generally more likely to be diagnosed at later stages. So
Mhm.
this is just unfortunately, it's just another one of those disparities that we see that with, you know, with equity, with, um, access to resources, all of those things, we wouldn't be seeing that. And sadly we are. And I think, to, I think to a large extent, because this has impacted and touched so many lives, I think that the resource that will come into our public health infrastructure will, I think, have a significant impact. Now, conversely, what we're seeing is that, rural hospitals are struggling.
Yes.
And so that's going to present some challenges down the road. Is how do we sort of, at the same time, support our public health infrastructure, at the same time, our clinical care, making sure that that is as solid as it can be.
Absolutely. I think, when it comes to that, the resources that the rural health departments and the rural hospitals have to offer, a lot of times it is a struggle. I have many family members, including my mother, she's deceased now, that worked many years in those sectors. And it's been difficult to, when things start coming down the pipeline of getting access to it, when the testing will come, when the vaccines will come. And I know that was such a big push in our last 90 days, really, that
And,
we've been
and
doing.
yeah, and people have to realize that, at local health departments, they have other jobs to do. So they
Yes.
essentially had to drop everything they were doing and
Yep.
saying, we're gonna focus like a laser beam on COVID. And so
Mhm.
everything else, now you got to play catch up with everything else that you were doing. All those important programming that you were doing had to be put on hold to focus specifically on COVID.
Yeah, and I saw it myself because I used to work, for those of you that know me personally, been knowing me for years now, I worked in HIV cure research for many years. And with HIV, it's kind of like we had to push that to the wayside because soon as COVID hit last March, it was really like touch and go. Like we just have to make sure that people are able to have access to testing. And once vaccines became accessible, people having access to information about vaccines. So
Right,
yeah.
right.
Yeah, thank you for that. So, as we move forward with that, what are your thoughts about the vaccines being accessible to people in rural areas in North Carolina?
Yeah. So, so it's interesting, so how the vaccines rolled out. So we first had, the two, Pfizer and Moderna vaccines, two shots,
Mhm.
about, 3 weeks apart. And so, and then going through the prioritization populations. So now, President Biden made the announcement about everyone 16 and older, should
Yes.
have access to the vaccine.
Mhm.
So, I think there was a lot of frustration and confusion early on because people said, well, why can't I get it? Why do I have to wait until, prisoners get it, or, people that may be on their last leg. And so, people don't think about this from the broader public health perspective. That's the strategy that we had to take, is to go through this sort of prioritization, because we didn't have it, we didn't have it all at the same time. We had to develop systems where we had refrigeration in place, and documentation systems in place, and all of that had to be created on the fly, right? I
Mhm.
mean, we really didn't start vaccinating until late October of last year. So we're
Mhm.
not even 6 months into trying to vaccinate the
Mhm.
whole U.S. population. And so, and now we've got the Johnson and Johnson vaccine, which now people are sort of concerned with all well, not with the blood clots, which
Yes.
is extremely rare,
Right.
relative to, to other vaccines or medicines that people take.
Right.
This is such a rare thing, but people are so, they're so worried because, these vaccines on the surface, it looks like these vaccines were created very quickly, and were there enough clinical trials to
Mhm.
justify rolling it out as quickly as they did? So, I understand people's hesitancy in thinking about the decision
Yeah.
to get the vaccine, and particularly in rural areas where there's limited access. But it's these vaccines are well tested. Um, they're minimal side effects. I've had both of my shots. The second one did have a little kick to it, so I
Yeah.
spent a good part of the next day in bed. But I felt great the day after, and so we will have a challenge in rural settings in rolling the vaccine out. Just you know for no other reason, just in that we have limited access to resources to distribute the vaccine. I know that community pharmacies will be very helpful. I live in Greensboro, and so I went to the big FEMA site here in Greensboro, and that was wonderful. But I know that not everybody has access to a resource
Right.
like that. So it's and then I think in rural areas, I think you do have there is more of the likelihood for people to maybe trust the government less, or trust public health systems and things like that. So it is it's a challenge, and so um, I think we just have to be up to the challenge to try to figure out the best way to get people vaccinated.
Absolutely. And I think I totally understand your last sentiments about that with the mistrust with the community and when it comes to government medical practices. I think, acknowledgement that, yes, those things have occurred definitely and have been detrimental to many people that are affected. But I think, overall in public health professionals are to a code and an oath to try to support the community as much as possible in the most effective and most clinically effective way, and being in HIPAA compliance and doing the things to bring and build trust and rapport with the community. And I know that's something when I worked in HIV work, we constantly tried to show the community, especially rural areas, all the time. We didn't want you to think the only time we're coming to your community is for a research study or for some type of clinical trial rollout. We wanted you to know that you could always still look at this as a community health resource,
Right.
and not just a place where only negative aspects in my life are going to happen if I go to this particular place. I'm going to be diagnosed with something or told I have a chronic illness or asked to participate in something for people with chronic illnesses. So, yeah, I think it's definitely about building that trust and rapport in communities. So.
Yeah, I mean, the first time when I had my first shot, I had the Pfizer vaccine.
Mhm.
We did a drive-through up at the Four Seasons Mall in
Oh,
Greensboro,
yeah. Mhm.
and you drive up. There's this long. We waited over 2 hours in line. You drive up in these big white tents, and there's military personnel all around.
Mhm.
And I was like, yeah, this could be intimidating for
Yeah,
people. You stick
absolutely.
your arm out, and somebody you've never met before, has a needle, and they stick it in your arm, and it's like, but yeah, it's I don't think we will ever see anything like this again in our lifetime. Just how COVID hit us, and then the public health response, and the sort of the rapid technology with the vaccines, and then the vaccine rollout. And I think I saw something the other day that at least half of the US population now has received at least one dose of the vaccine. That's astounding. I mean, that's amazing
Yeah.
that we have gotten to this point.
Yes, absolutely. It's such a short amount of time.
Yeah.
So,
Yep.
and I think it was just going into crisis mode, crisis intervention. Let's get here. And it can, like you said, some of the aspects of getting your vaccine can be a little intimidating depending upon where you had your vaccine done. I know
Yep.
they're trying to normalize it more being at local community drugstores and being at health departments and different other locations. Instead of like the larger mass events, they are trying to partner with like Walgreens, the CVS, and things things like that, which I think is great because those are often in a rural community somewhere, or they're in more aspects of different communities. So, and people know the people working there. So it might be able to build a little bit more trust and rapport of
Yeah.
seeing people.
And, you think about, so what's the corollary to this for people in rural communities? Well,
Mhm.
it's hurricane response, right?
Yeah.
So you think about how Eastern North Carolina gets hit pretty regularly with hurricanes, and
Mhm.
you've got flooding, you've got contamination of the water supply, you've got homes that have mold in them, uh, so the whole gamut. And so and in in some situations the response has been great, and in other situations it's been, I mean, I think there's still people that are trying to recover from the last hurricane, from
Absolutely.
2 years ago. And so I think there is some hesitancy that is the result of, well, look at what the government, what the what the response was to the last big event that happened in our community. So I think we just have to do a better job of communicating the importance of this. We you think about the number of elders that we've lost to COVID,
Mhm.
and how we won't get that wisdom from those elders again. So it's it's challenging, but I think we're up to the task.
I think so too. And I think accountability, like you said, of knowing that we have to move forward and push forward and do the very best of what we do.
Right,
It takes literally everyone doing their part to
right,
be able to combat a worldwide pandemic
right.
like to this source. So yeah, and prayerfully, like Lou Gent said in the comments, we will not see anything like this in our lifetime again. Yes, hopefully not. Absolutely.
Yeah.
So, what should people consider when deciding which vaccine is right for them? I know a lot of people have been talking on social media and sending me messages about, how do I know which one is best for me? And of course, my response to you guys, as many of you know that respond to me, is that's a discussion with your physician, because there's so many factors to look into that. We're talking about pre existing conditions, your body type, your BMI, your body mass index, all these different factors can come into my environment, access to vaccine. So, what are your thoughts on that, Dr. Bell?
Well, so first of all, the vaccine that you should choose is the one that you can get access to. I mean, that's the one that's probably the biggest factor is
Mhm,
what can you get access to. So
mhm,
I got the Pfizer vaccine because that's the one they had at the FEMA site here in town.
mhm,
The Pfizer Moderna vaccines work essentially, it's the same technology. And so and that you're going to have the two shots within
mhm.
3 to 4 weeks of each other. The Johnson and Johnson is a single shot, and so um, the data to this point has shown that it's not quite as effective as the two shots from the Pfizer Moderna shots. But it's if that's the one you have access to, then that's the one you should get. And so I think as more and more data becomes available to us, I think we'll see that the rate of 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 effectiveness of these vaccines will be in the 90 plus range. So I mean, and I know there was something came out recently where there were some folks who developed COVID after they'd gotten their second shot. Well, you still have this sort of 2 week window
Mhm.
where you know you're still at a relatively high risk if you're not um, you know showing if you're not practicing precautions. So once you get past that 2 week period after your second shot with the Pfizer Moderna, then your risk goes down quite a bit. Now, that's not to say that you can't contract the virus and transmit it to somebody else. It just means that your risk of developing significant COVID symptoms goes way down.
Right. And I think that's something where the community, we want them to be informed about that. Like knowing that you still need to consider the safe practices of wearing your mask, social distancing, washing your hands,
Yep,
still being conscious of those things we've been talking about since March last year,
right.
with also getting back out because summer is on the way. I know many of you have messaged me and said, oh, I want to travel. I want to go all these different places. I want to do all these different things. And I want to get back to my normal. And I
Right.
totally understand because it has been a year.
I
but,
agree. Yes. Yeah.
but
This summer I think will be different than last summer. So,
yeah.
so I think we know more. I think we feel
Mhm.
more confident about how we can, lower our risk. This last June, July, I mean,
Yeah.
it was crazy. I mean, it was
It
like,
was.
what? And so, we do have sort of this looming specter of these variants out there, but
Mhm.
so far the data has shown us that the vaccines work against these variants. Viruses are super smart organisms.
Mhm.
They have this will to survive, and
Mhm.
so they will mutate to help sustain themselves. But for the most part, what we're seeing, what's really critical about the coronavirus is these little spikes, on top of the virus.
Mhm.
That's the key to helping us, developing these vaccines.
Mhm.
And so that it's kind of its own undoing is that we can create these vaccines based on these spikes, and even though the virus mutates, it still contains these spikes that we use to create these vaccines.
Right. And I think that's where we all just have to do our part to stay as safe as we can. People are still looking to get vaccinated, and people who may have conditions where they can't get vaccinated. We
Right.
have to consider those who are vulnerable populations as well, and acknowledge the safety measures we need to take when being around friends, family, or whomever, coworkers. As people start to enter back into workspaces, that's
Mhm.
been a concern I've gotten a lot of messages about, will there be safety precautions at my workplace,
Right.
coming back into the office and being remote for almost a year. So yeah, I think it's all those things we have to take into account when figuring out the best choices for yourself. So
Yeah. All there was all this talk last year about herd immunity that
mhm.
like one of the European countries was um, wanted to try to adopt a herd immunity strategy, which basically means that about 80% of your population has some immunity to the virus, either because they've contracted it and their body's built up antibodies, or they've been vaccinated. So
Right.
we're not close to that, but I would say probably by, I don't know, by fall, maybe we'll, between the people that have developed COVID and survived and those that have been vaccinated, we'll be
Mhm.
pretty close to that. Now, there is talk. So think about this. We get a flu shot every year. So,
Yes.
influenza is a virus,
Mhm.
just like coronavirus.
Mhm.
I mean, it's a different virus, but
Right.
it's a virus. And so we have to get a flu shot every year.
Mhm.
And so will COVID be like that?
Mhm.
Pfizer came out just last week and said that they, in all likelihood, people that are getting vaccinated now will have to get vaccinated again next
Yes.
spring. So
I saw that.
so we're going to be like, here we go again. So uh,
Yeah.
but again, 16 months ago, we had no idea what COVID was. So,
Absolutely.
we're learning as we go here. We're building the plane as we fly it, as they say.
Definitely. It's just been so much a combination of so many things of people wondering, like, what will the virus do? What's going on with the new variants? Who has contracted a new variants? And how can we slow the pace down or shorten the curve as we
Right.
move forward with wanting to stop the spread of coronavirus? And then just still seeing across our state, hospitalizations are still going up, and people wondering as people start to open back up and go to work or school and all these different areas, how that will go. And I know some school systems have had some troubles as well with trying to keep students safe as well as staff. And I know that's been difficult as well. So, hello to all my educators out there that are watching. Many of you I adore. Thank you so much. I'm a former educator myself. So, thank you so much for watching. And
You
so,
know,
yeah, go ahead.
so I was just going to say, there's two unique things among many things, but two specifically unique things about the coronavirus and COVID-19, the condition that this virus causes. One is its ability to spread, and
Mhm,
it's a high, it's much more. The spreadability is much higher than it is for other types of viruses that we've seen in the past, and so that's why we had to go through this restrictive, process of distancing ourselves from other people.
mhm,
The other thing is that, because of what COVID does to the body and particularly to the lungs,
mhm.
so you had, these people who were developing, so, COVID is a SARS virus. So SARS stands for severe acute respiratory syndrome. And so when the coronavirus, when it impacts the lungs, it can wreak havoc. And so that's why you hear about, people being intubated, being in intensive care. And that's what's so challenging, is that, the ability to put people, on these ventilators and keep them in intensive care for weeks.
Yes.
You run out of the ability to do that. And that was what was, when they talked about, flattening the curve, that's what they were talking about, is that our hospitals just didn't have the capacity to just say, hey, y'all come, we'll put
Right.
you on a ventilator. It just, we didn't have those resources. And there was, there were some delays in trying to get those ventilator resources from the federal government to the state
Mhm.
government. So that presented a lot of challenges.
Absolutely. And hello to all of our people that are essential staff out there, because the PPE was getting low. There was a time when we didn't have access to all the PPE materials we needed to keep our staff safe that were essential workers.
Right.
And with essential workers, I mean medical professionals, transit workers, people that were working in public services such as grocery stores, drugstores. Each of you, thank you so much for your continuous service from the beginning to now, because you've had to be there on the front line to keep us all safe and give us some type of normalcy. So, yeah, awesome. So, my last question for you, and then I'm coming to the comments, guys. I see you over there. Have you seen research that talks about cancer patients and the COVID-19 vaccine potential risk?
Yes. So the challenge you have with cancer patients is that some cancer patients go on chemotherapy, and chemotherapy is like the equivalent of using a sledgehammer to kill a fly. So
Indeed.
it is a full-on attack on your body, and for, some period of time, your immune system just gets
Hmm.
beat down. And
Hmm.
so to try to use, to vaccinate somebody in that circumstance, with the COVID vaccine, it can be just overwhelming for the system. And so, you know, with the exception of that, that period of time where you're going through that acute chemotherapy, they do recommend that, if you're a cancer survivor, yes, absolutely get vaccinated. But, if you are in that a period where you're going through the intensive chemotherapy, then you have that conversation with your oncologist about, you know, at what point is your body ready to take on this vaccine.
Absolutely. And I know I saw my mother experience chemotherapy and radiation for breast cancer and rectal cancer. And it was tumultuous on her body. It was wreaking havoc, literally. And I think it's good that we talked about cancer, because I had a lot of people ask me, being regards to cancer treatment and taking the vaccine, what their risks may be. And I think it's great. Talk to your oncologist, speak with your physicians, talk to them to set a medical plan that's best for you. It's
Right.
every person is unique and different. So I definitely think you should set what's best for you. Mm.
Right. And the other thing, unfortunately, is that, a lot of people with cancer have other conditions that,
Mhm,
that they need to think about, be it high blood pressure or diabetes,
mhm,
or,
mhm.
kidney disease, all of those things that put you at risk for COVID, also oftentimes, manifest themselves in people that have cancer. So they're sort of juggling multiple conditions. So not just, consider what you're going through with your cancer, but other health conditions that you're dealing with.
Absolutely. And also, I've been waiting for research for people who consider morbidly obese, what that looks like for someone or women who in childbearing age. Also, some other factors, and
Breastfeeding.
breastfeeding or maybe expecting with
Yep.
child,
Yep.
what that looks like. Awesome. Well, we've got some great comments here. Let's see what our questions are. Are there grants and other resources available to the smaller tribes that could facilitate knowledge building around public health crisis? Okay.
I'd certainly there are foundations that provide infrastructural funding. North Carolina, Kate B.
Mhm,
Reynolds, Duke Endowment. Yeah, so I would say that's a place to start. I
mhm.
think it's important to have a very clear plan in place and a way to evaluate the program that you're wanting to implement. But I would say certainly starting with foundational grant agencies is the way to go, and doing it in partnership. I think
Yeah.
trying to fly solo is not the way to go these days. So I think you definitely need and kind of thinking out of the box type of partnership. So just trying to bring as many people to the table as possible.
Yeah, like we're here tonight. So it's about having a conversation of reaching people from your audience and my audience to give people more knowledge and things to think about.
Yeah,
So collaboration is good, everyone.
yeah.
How can NCDHHS build a better crisis response infrastructure for Native communities in general? Oh, that's a very loaded question. That's a big one.
Well, so I know, so I served on the Secretary Cohen's, the historically marginalized community committee. And so I know that there has been a lot of discussion about how the state responded to testing and now how it's responded to vaccination. Because, it was interesting in North Carolina, we, in the first few months of vaccine rollout, we were near the bottom in the nation, and then we just
Mhm,
shot up to the top.
mhm,
And so that was great to see.
mhm.
But so I would say, first of all, I think it's um, having in writing tribal consultation policies where there's a very clear plan in place for issues like this.
Mhm.
I would say partnering with the State Office of Minority Health and Health Disparities. So
Mhm.
Cornell Wright is a member
Yes.
of our
Hi,
um,
Cornell.
he's a member of our health board, and he's
Mhm.
wonderful. And so his
He is.
office is a great resource.
Mhm.
And I would say that Greg Richardson and
Yep.
the Commission on Indian Affairs,
Mhm.
that they continue to have a voice in Raleigh. So
Mhm.
I would say sort of the combination of those three things, I think we've learned a lot of lessons in the last 14 months. So hopefully those messages will stick.
I think so too. And yes, acknowledging both of those men, because those men have definitely been doing some great works to help the communities across the state and
Mhm.
trying to keep people safe and give them more knowledge and education as much as possible and challenging people to really get out there and step outside the box when it comes to how we combat with this vaccine, as well with the virus rather, and how to get access to the vaccine and different clinical testing and things like that. So yeah,
And Greg, to his credit, has for a long time pushed our state leaders, say we need more data. We need to
mhm.
know what's going on. We need a better better system of accountability in place
Mhm.
to let us know what's going on in our Native communities.
Absolutely. I totally agree. So we have here wondering if you could discuss any conversations or research about a vaccine booster later down the road. So I know we did touch briefly on that about the possibility of the booster being every year. So I guess there'll be more forthcoming data and research on that as we move
Yeah, so Pfizer really is the only one of the three that's come out with data in that area. You know,
forward.
there is a fourth vaccine out there in Europe. AstraZeneca has
Yeah.
created a virus vaccine, but for whatever reason, it has not gone through FDA approval in the
Hmm.
US. So, you know, so the more tools we have at our disposal, the better. But I mean, I will say that probably in the next maybe next 2 to 3 months, we will know not just from Pfizer, but also Moderna and Johnson Johnson, whether there will be the need to have a booster and, you know, next year.
What that looks like.
Yeah.
Yeah.
And, you know, and the other thing, you know, people need to keep in mind is like, you know, with influenza, I mean, we have an influenza season, right? So
Hmm.
essentially from late August to, you know, you know, March.
Yep. Hmm.
We don't know if we have a season with COVID. We just
No,
don't know. So
hmm.
I mean, we know that the more people are around each other, they're going to spread it. But
Hmm.
you know, other than that, we don't. You know, does it respond to cold or heat? We don't know.
Hmm.
So I think you know we get another you know 6 to 8 months under our belt and sort of looking at you know the natural history of how this virus operates, then I think we'll be in better shape.
I definitely agree. I think studying the evolution of the virus and seeing how it started and how its progression, and even with the variants and mutations that's going on, looking at the data and the research, and time has to come. We have to give it time, just like with the vaccines, that takes time.
Right,
All these things are on a time watch, and in the midst, we're all just trying to do our best to stay as safe as possible.
right,
So
exactly.
yeah,
Yeah,
absolutely.
and you know we think about you know with the vaccines, you know people say, oh well, how did we create a vaccine so quickly and how did we get it rolled out? You
Hmm.
know, because you know vaccines have to go through clinical trials and
Right.
you know the advantage we had is the technology had been developed for many years. It's
Hmm.
and so the timing was great in that the technology, the mRNA technology had already been created, and so they just tailored it
Right.
to the this particular virus. So that's you know people need to understand that it's not just all of a sudden somebody woke up one day and figured out how to do this. They had been you know trying to develop this technology for at least a decade, and so now they had the opportunity to utilize it with this particular pandemic.
And I'm glad you brought up that point, because a lot of people did feel like, well, out of the blue, where did these vaccines come from? And then, like, here, I'm just hearing about the virus itself. And now there's talks about these vaccines, and that I'm supposed to go to these different locations. And I think what really kind of put people kind of in a panic mode too was the fact that you could not gather with people any longer, as you
Right.
have with other viruses. Other viruses, it may be sexual contact, it may be short, brief times of contact, like with the flu. You may not be able to see someone for a week or two, but then to think about, I can't see you for a year or months on end. That itself, and then not knowing exactly how I may transfer it to you, or if I am someone who's carrying it and may not have any symptoms and be asymptomatic, just all these kind of factors of learning what this is. And I always try to think that everyone doesn't have a research and science background. So that's why community talks like this are really great, because it lets people know in the community that there are people behind the scenes working diligently to make these types of works happen to the
Right.
public.
Yeah.
Hmm.
And it's I mean you know and I you know it unfortunately it became very political
Hmm.
and so I would have never imagined that we would get to a point where
Yeah.
you know asking people to wear a mask for public health reasons would become a political
Yeah.
you know political issue. But I am I think I um, am very proud of the fact that you know a lot of people, a lot of frontline workers, a lot of you know people who sort of stood in the gap for a long time and risked their lives to help us to be safe. So I'm very grateful to the people who you know my brother's a pediatrician and so you know I'll sometimes get on a Zoom call with him and you know he's wearing a mask and you know
Mhm.
it's like he's trying to protect himself, and but he's also working in the community. So I'm grateful for those people that do that work.
Absolutely. And if you're an essential worker out there, thank you so much for all that you do. Like I shouted you out earlier in the talk, is that, there was so much uncertainty, but you were there. You were right there in the midst of a pandemic, and we're still going through it, and you're still there. But even in its darkest days, if we thought that were going on, you were there, and you were being an essential worker and putting your life and family and everything else possibly on the line to protect others and humankind. So, thank you so much for all of that. And so we had some comments say, yes, thank you for those who work in public health, such as us. So, yes, definitely public health workers, definitely want to thank and acknowledge them as well. And I think it's very important that the community continues to learn and follow what goes on with the virus. We did have a lot of political things going on. We were in the midst of a presidential election year. We had some civil unrest. We had a lot of injustices happening. We had so much going on between protesters, and then we had like I said, the administrations were changing over from Trump to Biden. So it was just a lot going on top of a pandemic.
Yeah,
Um,
2020 was a year.
it
It was
literally
a
was
lot.
a whole
It
year.
was a lot packed in one year, but yeah,
Yeah.
it's and it's when you speak about resiliency, I mean that these are the times when resiliency becomes important, and
Yeah.
having the ability to stand up for one another and care for one another. My mother is 89 years old, and she's you know you know, bless her, she's not had COVID, and she's been at home, but her church in Pembroke, they've had drive-in services, and she's been to
Mhm,
all but one of them, and she's been just calling friends, and
mhm,
people stopping by, her neighbors, and bringing her food, and
mhm.
it's a tremendous blessing, but it's I know it's not easy on her.
Yeah, same with my dad, being a widower. And then, my uncle also. So just like they have each other in the same area, but I'm glad that they have each other to talk to and be pandemic buddies, through all of this, and acknowledging that I taught my dad how to do FaceTime and Zoom and just like all these different things. My uncle, not so much yet, but I'm going to bring him into it after a while. But my dad is definitely a FaceTime guru now. He knows exactly what to do. And we have some great talks about things like this with COVID-19 and the vaccines. And he was able to make an informed decision when it came time for him having access to the vaccine and go get the vaccine and everything for himself. So I'm so glad we had this talk tonight. This
Yeah,
was
thank you.
awesome.
And I'm sorry for the little hiccups we had there at the beginning. So
Oh,
hope
dang.
you didn't lose some viewers.
No, we didn't. We had some really stronghold viewers. Everyone, thank y'all so much for watching. And you know what I do at the end of every show, or sometimes I've done it a little bit in the beginning. I always acknowledge some family members or ancestors of mine. And tonight I want to honor, and let me share my screen here with you guys. Um, going to acknowledge, I know I've mentioned her quite a bit here for you guys tonight, my mom. And some of you that have been watching for quite some time have seen various different images of her I've posted, but here is one fun one. This is my mother, with the red hat on, and her name was Wilstine Lucas Knight. And then in the middle was her great aunt, my great aunt, I'm sorry, her aunt, my great aunt, Bernice Lucas Harris. And then in the blue was my aunt, Anna Lucas King. And I want to acknowledge these three women because they are now my ancestors, and they were so amazing. We were actually at a family reunion dinner together, and this is probably about 20 years ago almost now, this photo. And I just want to acknowledge them. They were from Spring Hope, North Carolina. So if some of you are out there from Nash County, hello to you. But each of them taught me so many different life lessons. So I always like to acknowledge family and ancestors that have taught me so much. They were amazing cooks. They were amazing women in the community, and they were loved to plan family dinners for our family. They just loved a sense of community, enjoyed their churches they attended, just always about family and community. And I just wanted to acknowledge them tonight, and definitely let them know that I was thinking of them. and all of that. And so, thank you everyone for joining me with Dr. Ronnie A. Bell joining us here. Thank you again for being here, Dr. Bell.
Thank you for having me, and thank you for sharing about your family. It's just a wonderful photo, and just I
Thank you.
know that takes you down memory lane, and so thank you for sharing that.
Yes, absolutely. Many, many good times. And now I'm the one that helps plan the family reunion. So it passed down to me.
Put it
And
on.
so me and some of my other family members, we plan, and when it gets safe again, we plan to have another reunion. But I want to thank everyone for your comments tonight. And I want to thank Stephen Bell for watching tonight. He's out there. He's from Guilford County's American Indian Education Center. Thank you, Stephen, for
My
watching.
son.
Oh, nice. I did not even know that.
That's my oldest son. Yes.
Small world. Well, I was on one of his platform talks that he had during Black History Month. So definitely want to acknowledge Stephen for watching and tuning in and always being so supportive. And to all that watched tonight, just want you to take away this information tonight to make some informed decisions for yourself about COVID-19 as well as about the vaccines. I will be posting this on our YouTube page. This will go up probably in the next let's say hour. I don't think it should take me too long to load it, but definitely please check it out when you can. Feel free to share with family and friends that are not on Facebook Live. And again, thank you everyone. You can join me back here next Tuesday. We're going to have a special treat. We're going to have some really awesome ladies who are from the Coheri tribe, and I don't want to give it away, but they are tribal royalty. So that might give you a hint. So they're going to be talking about the importance of the matriarch society for Native women. So I am very excited to have that talk with them. I want you to join me back here next Tuesday at 7 for that talk. And I'll reveal to you guys later in the week who those special, awesome people are from the Coheri people. So again, thank you everyone for watching. Take care, everyone. Thank you. Yes. And we're going to stop our stream. And let me make sure it ended for us here. It's catching up. I didn't want to give away my new guests that are coming next week. Give it a surprise. But let's see if it stopped. Let's see.
I still see the recording button at the top.
Oh, recording is fine. I'm getting ready to stop